Hi, everyone, and welcome to the COVID-19 vaccine show. I'm excited to welcome Dr. Mark Hayden. Dr. Mark, what's going on? How are you?
I'm doing great.
Last week we saw you swallow the latest version of COVID-19 by drinking and also putting it on a cracker. Now, again, we're hearing more and more the virus is deadly. The virus is in a really bad shape, and everyone, the only way we're going to change things is to get everyone vaccinated.
Yeah, the virus is deadly to those who don't have an immune defense. Those who don't have an immune defense are those people who lack a normal immune system and never have had immune exposure. Immune exposure comes in two patterns. It comes in respiratory exposure, where you inhale it and you get pulmonary complications and you transmit it from your lungs to other people. Exposure also comes from having it on your food invisibly, because the virus is heavier than air. It settles out. So then when people are speaking, singing, talking, it is going out of their chest and it is depositing. It's going on your food, on your takeout, on your spoons, on your plates. It's going everywhere. So what I am saying today is use the word exposure, not just cases. Now, this is the first time you've been hearing COVID for 18 months, some odd. Have you ever heard the word, let's just talk about exposure? Not really. But it's all about exposure. I'm sharing the screen with you, and this is Worldometers. It is the current, actually it's yesterday's reading. Let's look at USA numbers. Look, USA numbers, total cases 35 million. Now that's cases. Is that how many exposures we've had? No way, Jose. Case is defined as somebody who had a positive PCR test or a positive antigen test.
Right.
Let's say you bought takeout during some of the pandemic. The people serving your takeout were breathing COVID virus all over it. Do you wash your salad off? Do you wash your hamburger off when you buy takeout? I don't. I just eat whatever they prepare for me. So you were swallowing virus from your environment, because literally it was getting everywhere in the restaurants. It was getting everywhere in your kitchens. It was getting everywhere. Now, when did you have the opportunity to make a case? If you became symptomatic during a pandemic in the United States, you might go down and get tested and have your nose swabbed or your mouth swabbed. Big deal. But if you had no symptoms, you know what you did? You, most of the time, you saved yourself the money. You saved yourself your time. You didn't go anywhere. So the actual exposures are 10 times probably, or not 10 times, they're probably close to 6 to 8 times the actual number of true cases that were positive by PCR or antigen test.
Because many are asymptomatic the entire time.
That's right. Now, why in the United States are so few people dying? Look at these new deaths over here. Yesterday, 49. Now, it was well known that the highly transmissible variants were sweeping across the country. It was well known that people stopped wearing masks about 2 months ago. And yet we only have 49 deaths. What happened to the big COVID variant death wave? Well, what happened was simply this. Most of the American population had already been previously exposed to the earlier membrane proteins of the original coronavirus that was being spread. So we had exposure throughout the United States in the prior waves, which made us much less susceptible as a country to death rates. Look at that, 49. Look, 49. 49. Remember, there was almost a peak load of 4,000, 100 times that. And this is a variant this variant, which has already swept across America, it swept across America in the beginning of June and July. It's already passed through your state.
So you're thinking there was an agenda by having people take all their masks off to get a few more cases so that they push the vaccine more.
I don't want to use word. People were so sick of wearing their stupid mask, and the mask didn't work on an aerosol anyway. Let's just be honest. Masks were very ineffective on a true aerosol. It doesn't stop the spread. So because there was so much exposure in the first waves. Now, you can say, well, that's all an interesting theory to explain why the death rate in the United States is so low. What do you have to back that up, Dr. Hayden? Come on, let's just be the devil's advocate. I want, show me the proof, right? Show you the proof. Let's just go ahead. Let me hit share my screen again. Hold on.
The screen's on.
Okay, let me get this one. Okay, you see this viral load?
We don't see that, Mark.
Okay, can we share this screen? Hold on.
So you might just need to open up another window.
Okay, hold on. I'm going to come down here to share screen.
So you could stop share for a second, then share again. That's probably the best. Okay. I'll stop share for you. Yeah, we're talking again with Dr. Mark Hayden here on the COVID-19 vaccine show. And what we're seeing is the death rate numbers in the United States are much lower than India, than other countries, even though the highly transmissible virus is going right now. Okay.
Yes. Now let's go through here. This is a sewer shed surveillance project. What that means is we go into the sewer systems of Missouri and we go and we look and we see where is the new viral load from COVID showing up at. And as we go through here, let's just start popping some of these. We can see the real peak. Look at this peak right here. Can you see this peak where got my cursor? Do you see the viral? Hold on. Let me see. It says I'm screen sharing. Do you see a viral load?
Yes.
Okay. Notice that in late November, the viral load goes sky high in the sewer systems.
Yes.
You see that? You see the viral load go sky high? What that meant is the coronavirus variants that were spreading at that time had very fertile, I guess that's fertile intestines to grow in. There was no immune defenses.
Okay.
And so they could grow there for days, weeks, and produce a lot of viral load. Now, if we look down here to July, there is a little bit of a peak in July. But what happens is it's a very short peak, because I was exposed when you're exposed to coronavirus the first time, you don't have any immune memory, but you learn from your exposure. That means when you're exposed to your second variant, it doesn't grow as well because you suppress it with your immune system. So the viral load that comes out of your intestines during the second rounds of infection are much lower because of your prior experience. So what we see here is that true viral load is much, much lower this time, because most of the people, vaccinated and unvaccinated, have already been exposed. Does that make sense?
It makes complete sense.
Yes. So what now? Let's just see what. Let's look at. Hold on. Let me go back. I'm gonna do stop share, and then I'm gonna go back to share screen, and I'm gonna go back to this. I'm gonna hit share on that. Okay, now we're back to this. Let's go back and talk about Missouri. Okay, if we look at Missouri, here's good old Missouri. Missouri's a place that we know the Delta variant went throughout. And it was tracked through the sewer system all the way back in mid-June, early June. So we know that with that highly transmissible variant, it went throughout the state of Missouri very rapidly within just a few weeks. We know that peak death rates generally happen 17 days after exposure for somebody who is naive and never seen it before. But if you've seen it before, your immune system is at least partially prepared. You will have fewer symptoms or no symptoms.
Right.
Okay. Now let's look at let's see if this holds true in Missouri. Hold on, let's see. Missouri.
Okay, there's Missouri right there.
Okay, here we go. Now let's look at these Missouri cases.
All right, scroll that
And
up.
you can actually do the same in your same state. I'm just picking out Missouri because so much is known about it, because it was a hot spot for Delta infections. Look at these daily new cases. Okay, now remember what I said about a case. The max case.
Do you think it's going to go up to the highest level that was in 2020?
Let me tell you, if the new variant is so good at spreading, let's say we had 100 million test kits just for Missouri. Missouri's got 6 million people. So if you test every person once a day for 7 days a week, you're going to go through 42 million cases. Test kits a week. That's a lot of test kits.
Mm-hmm.
Okay. But guess what? What you would find is the real number of cases in Missouri is not 3,000. The real number of cases is probably 10, 20,000 a day, maybe 30,000 a day, if you force those people to be tested. But guess what? They're asymptomatic. They're not even getting tested. Does that make sense?
It makes complete sense. So let's talk about this.
Okay, so guess what?
Let's look at India. Let's look at India. That'd be
okay, watch this. Hold on. Now let's look at the same death rate. Look, daily deaths in Missouri.
Totally down. Totally down.
They disappeared.
So why are they saying this is so deadly, Dr. Mark? Because
it's deadly to people who have no experience, who had no exposure. Now, I told y'all a very bizarre statement. And I hope my listeners are international people from India, from China, from Asia. And I have many people that are from America that think in international terms. And I hope each one of y'all pray for populations that have no exposure and no immune defense. Those are the people you should pray for, because those people have a highly transmissible variant at this point. And if they have no defense, they are in deep, deep trouble. From the first time I met you, I told people to get an immune defense. I told people to get an intestinal inoculation of live virus. And in fact, I told the CDC that. I told the Department of Homeland Security. Unfortunately, stupidity doesn't just exist at the Department of Homeland Security. It doesn't just exist at the CDC. Stupidity exists. Well, I guess the better, more kind word is ignorance exists in North Korea and in China. China had outstanding diagnostic facilities, and they would try the strict quarantine. China is getting into all sorts of problems because as the variant mutates, it becomes better and better at transmission. It is likely that their idea that they can quarantine themselves out of this will fail. They must choose a way of getting immunity. And the best way of getting immunity is, as I have always said, through the intestinal tract.
Okay, so we've talked about this many times. I'd like a little comparison. Look at India. Let's go to India's death rate. Because why they had, let's take a look at India's death rate and look at the scale and what's happened and how things have changed from when they really were hurting. So let's go to that real quick.
Okay, here's our main.
Is that India?
Now we're coming down to it. Hold on.
Mark Hayden, Dr. Mark Hayden understands so much about this vaccine, the virus, and he's predicted everything when everyone was saying it's over. Don't invest in big stadiums, don't invest in these things, because as long as there are cases and there's not enough vaccines out there.
I will say this, for people who own big stadiums, what is occurring in Missouri is your best hope. And I tell you why. Let's say I owned a big stadium right now. I can point to Missouri that the virus is being constantly transmitted, but we have a low death rate.
Right.
So I could say that maybe this fall, if our death rates stay real low, let's face it, everybody's had the virus. Everybody's going to keep swapping new variants, but the symptoms are going to be so low that nobody's going to die from it. So let's just go, and maybe 1 or 2 people might get a cold and nobody's going to die from it. So that argument looks much better than things looked last year for people who own stadiums. It actually looks better for people who owned cruise ships.
Yes.
Let's say you were taking a cruise ship and we only let people on the cruise ship who are from Missouri, who have been exposed on their food, and we know that the COVID waves have gone through all of Missouri, and that when they get on the ship, they've already been exposed. The death rates on those ships is going to be extremely low. You're going to have low liability, and you're still going to be able to take a cruise for everybody on Missouri.
Yeah, let's take a look at India real quick.
Okay, hold on. Let's see. All right, let's see. Here we go. Okay. India. Okay. I got to go back to the day before. Yesterday. India, 38,000 cases, 411 new deaths. Okay. Now, if you'll notice, in the USA, we had only 49 deaths yesterday out of 35,000, actually 13,000 new cases. That is one in, it's a death rate of very, very low, very low ratio. So if we look at India, they had a total of 38,000 reported cases. But see, actually the number of reported cases there, multiply that by 8. There's probably 250,000 people contacted the virus in India.
Yeah, let's take a look at, can we see that graph? Let's take a look at the graph for India.
All right, here we go. Here we go. Here we go.
Because I'm interested to look at when really things were going bad for their second wave.
Okay, look, total cases in India are flattening out. You see how this last curve starts to flatten? And if you look at the daily new cases. The daily new cases in India shot right through the ceiling, didn't it? And now they're peaked out. Now let's look at active cases. Now let's look at death rates. Daily new deaths in India. Down lower. Here it is. It's not peaking up. It's going down.
Why did it go so high in between that time, but it's not happening in the United States like that?
Well, their first wave did not spread. We actually had much more spread in our environment. They didn't have a sewer shed project to show where it was being spread at. In other words, I can look at our sewer data in Missouri and show that COVID in the sewer systems hit a peak last year in Missouri. It's not hitting that peak this time because most of the exposures have already happened. Okay. That's right. So in Missouri, there's very few, by far most of the population, including the vaccinated as well as the unvaccinated, have already been exposed and already have some degree of immune protection. That's right.
So unbelievably enough, after we kind of look at all this in many areas, what we have learned from this process, what we have learned is that that India, we're learning from this process is that oral inoculation is the best idea. And if there's a push for the vaccine, expect your news media to talk about this variant is deadly, look out for it, but yet we're not seeing it in the numbers. And
Now,
so
here is one of the problems, Neil. If you're running a propaganda program for the CDC and you've told all these people they were doomed if they didn't get a vaccine, and then you tell them honestly that 80% of the people have been exposed to the new Delta variant in Missouri, and then you tell them that, well, I guess we didn't have hardly any deaths, and the vast majority, 95% of cases are asymptomatic, more and more asymptomatic cases and fewer deaths. That makes it look like it was unnecessary to get the vaccine. Then you have to deal with, as soon as people begin to think, well, I didn't have to get the vaccine, I could have used oral inoculation. Then they look at the CDC and say, why didn't you have some form of oral inoculation? Then they come up with a bunch of excuses why they chose the injections, IM, instead of doing oral inoculation. This is all about CYA covering their mistakes of the past. Oral inoculation was available last year and could have been done on every American within 6 weeks. There was no need for this widespread pandemic. You could have inoculated everybody in the United States within 2 to 3 months, and everybody would have been exposed. Nobody would have had to have any lockdowns. Nobody would have had to have a loss of their civil rights. But hey, guess what? That wouldn't have served the needs of the people who were in charge. You see, government, especially the government of the United States, is not about serving the people. It's about serving those who have control of government. And those are two different things. You know, you live here, I live here, we're born here. And, you know, in a lot of ways, it's so much better than banana republics in South America. And it's better than many countries abroad. But still, the government has to have an open, transparent policy that is debated publicly. They didn't debate these issues. They didn't, hey, guess what? They decided these deals behind closed doors, where the biggest people there were the lobbyists and lawyers for the big pharma companies. That is, hey, they told your doctor not to get involved, to go home. They closed their practices, told them to shut up and keep their mouth shut. But you know, the doctors in your community were not stupid. They weren't dumb. They're not retarded. They should have advocated for their patients. Inoculation has been around for centuries, and it was the simple, fast solution. And now they're talking about, guess what? You're going to need a Pfizer booster. Laugh my ass off. Now, I mean, or you're going to need a Moderna booster.
Oh,
are you going to be needing boosters the rest of your life?
exactly.
I guess so.
Until we get
Yes.
the oral vaccine.
Yeah,
So,
and now here's, you know, Neil, the real way to test who has the best immunity is to do what I do: inhale live virus.
yes. Okay.
You know, oh, and you know why that's not done? There's an excuse for that at the CDC. Oh, we don't want to subject people to the risk of dying. No, if you believe in your product, you test at the risk of dying. You can never eliminate all tests.
Okay.
You know, when does Elon Musk drive a Plaid Model S? He does, I'm sure, because he tests his own vehicle. Risk is always present in life. We should be comparing the immunity of the different brands using live inhalation on live subjects. And if you can't find the people to do it, you need to go to your pharmaceutical, the people that made it, say, hey, give us some of your pharmacy executives and let's test it on them.
Okay.
You know, you'll see videos with me. I test my product. I test it repeatedly. I'm alive. I've tested it. I've inhaled at least 5-6 times without mask. I was the first physician in the United States not to wear a mask deliberately around positive patients because I had already developed an immunity.
Okay. So, all right. So in closing out, you always have your final say.
Yeah. You know, my ancestors were men and women. Infectious disease and viruses were around them all the time. They would see their family members get sick and die. Some of my family members and my ancestors had 8 and 9 children. And it was necessary to have that many children because so many died off before reaching productive ages. And yet, many of the things that protected them, they could not understand. They didn't even know what a virus was. The reason I'm alive today, and the reason you're alive, is not because we understand all the processes that affect our survival, because we don't. We're alive because God has a plan for us and a destiny for us. Every day that you have is a gift. It's a gift from God. You need to make the most of that. And you need to live each day to the max and make your days count, because your days are numbered and my days are numbered. I won't be dying of COVID or of coronavirus because I already have immunity to the membrane protein. And the membrane protein doesn't change much regardless of the variant. The spike protein changes. I can die from a car wreck, a heart attack, a stroke. And on my appointed day to die, I'm going to die. I accept that. But I've got to make the most use of today, and I don't want to live in fear. Certainly, you want to have immune protection from coronavirus. It cannot be stopped. It is highly transmissible, and you want to have immune protection. So get exposure in the form and develop an immune protection in the manner in which you will have the least side effects. And that's what I've said from the get-go. Inhaling COVID without immune protection can lead to very serious pulmonary complications, long-term pulmonary disease, long-term fatigue, and a very unpleasant life. You may not die, but you may be very short of breath. Eating COVID, ingesting it orally, is an exposure that actually protects people. The World Health Organization was correct when they said that eating COVID is not dangerous, but they should have gone a step further. They should have said that eating COVID on your food is actually protects most people. They did not. They didn't want to go there because they wanted to get behind big pharma, big money, and they wanted to serve all their traditional approaches. But the most traditional approach is to use oral inoculation. Oral poliovirus has worked for years. We had inoculation using live virus for measles. And in fact, we still do use a measles live virus, I believe. Yeah. And really, these things were not open. They were not debated nor discussed. They were rammed down the throats of the CDC in private meetings. Trump did not understand this virus. And Trump played right into the hands of the CDC, and Trump lost his job. He trusted the wrong people.
Right.
But, hey, that's not me. He had other choices and other options. Live each day like it's going to be, like it may be your last, and make your days count. You have a great day. Thank you.
All right. Okay. So that was the COVID-19 vaccine show. What an amazing show. Again, make sure you like, share it, and trust me, it's going to go out everywhere, especially when Dr. Hayden ate COVID. Take care, guys.